If I were a healthcare provider adopting artificial intelligence into clinical practice, here's what I would look for when it comes to artificial intelligence insurance coverage exclusions. It's fair to say the adoption and use of AI is moving at a much quicker pace than the legal framework of AI when it comes to alleged medical errors in clinical practice. Is this something within inside of your control? Not necessarily. But from an insurance perspective, there's a critical takeaway to monitor. The development and implementation of artificial intelligence exclusions, sublimits, and riders within inside of an insurance policy. Here's why it matters. Some insurers have adopted and filed policy exclusions in order to limit their risk. In turn, state regulatory bodies have approved the exclusions. This means the option of adding an exclusion to a policy lies with the carrier. So as it relates to artificial intelligence coverage exclusions within healthcare, the time is now to be diligent. Let's highlight two important needs. Item number one, start your renewal discussions with your insurance advisor and underwriting carriers early. It's suggested 100 to 120 days in advance is a good start time. And item number two, review policy forms, endorsements, and exclusions before binding coverage. The short-term goal is an understanding of how an AI exclusion, rider, or sublimit impacts coverage, and determining whether or not your insurance carrier is willing to remove the exclusion. The long-term goal, which should start before artificial intelligence is used in a clinical setting, is documentation governance, as this will bring added support in the event you are deposed due to a medical malpractice allegation. So regardless of your area of specialty, if you feel as if you're unsure where your current insurance carrier stands as it relates to AI risk in a clinical setting, or if you feel as if your renewal process is rushed and doesn't allow sufficient time to analyze policy forms, endorsements, and exclusions before binding coverage, contact info can be found up top, or comment strategy and we'll schedule a private consultation.